Hello, and welcome from the Feed the Future Innovation Lab for Food Safety. Thank you for joining us for today's webinar, linking food safety with health and nutrition, insights and priorities. My name is Michał Matejczuk. I'm a PhD student at Cornell University, and I'll be your MC for today. Before we welcome today's panel, I'd like to direct you to a few webinar functions. At the bottom of your screen, you should see a chat icon. Kenny Christensen from Cornell IT is providing technical support today, so please post in the chat if you are experiencing technical difficulties. Today's webinar includes a Q&A with our panelists. Please submit your questions using the Q&A icon at the bottom of your screen, and we will answer as many as time allows. This webinar is being recorded, and we'll notify you next week when it is available on the Food Safety Innovation Lab website. Now, it is my pleasure to introduce today's moderator, Dr. Haley Oliver. Dr. Oliver is the director of the Food Safety Innovation Lab and a professor of food sciences at Purdue University. Her research focuses on the prevalence, persistence, and transmission of Listeria monocytogenes and Salmonella in retail food systems and the development of control strategies to reduce cross-contamination. Dr. Oliver is also working to strengthen the food safety capacity in Afghanistan, Nigeria, and Peru. With support from USAID, Dr. Oliver and Purdue colleagues have developed a food technology program at Herat University in Afghanistan to improve food safety, quality, and security. Since June 2019, she has served as the director of the USAID Feed the Future Food Safety Innovation Lab. With that, let me ask Dr. Oliver to take over and get us started. Dr. Oliver, over to you.
Thank you, Michał. It is certainly my pleasure to welcome you. Thank you for attending our third webinar. We have almost over 150 attendees online already, and we're really thankful that you're able to join us. We have a very exciting panel. What it would be this morning here at Purdue University that'll talk about really the interface of nutrition and food safety. Next slide, please. So the Food Safety Innovation Lab began in 2019, and really I view our charge as integrating food safety into the language of food security. And we know that food security generally means that we have nutritious food, we have access to it, and that there's a sufficient supply of it. But what we argue here at the Food Safety Innovation Lab is that it also has to be safe. So if we don't have safe food, then it undermines really the other pillars of food security. Next slide, please. We also know that unsafe foods play a really important role in the interface of nutrition. Whereas foodborne disease is very common around the world, an estimated 600 million cases or so globally annually. And those foodborne diseases can manifest in a number of ways, but certainly diarrhea and vomiting are some of the symptoms that are very commonly associated with disease. Of course, if you have those symptoms and certainly the disease, you are in a state where you may experience malabsorption of nutrients, which certainly can lead to malnutrition. And if these diseases persist, if they're really a chronic disease or an endemic situation, it can result in stunting and increased comorbidity. And certainly if you're infected with one of these diseases, you can be disseminating those pathogens into the environment. And so as we see more of a load in the environment, that can then translate into unsafe foods through cross-contamination events. So really an unfortunate, if you will, vicious cycle where food safety and nutrition, where food safety can undermine nutrition. So as I mentioned, we have a very exciting panel of speakers today that have collectively well over probably 60 years of experience in the field working in nutrition and health, and now certainly how food safety integrates into this discussion. So it's my pleasure to introduce our first speaker. Shanda Steimer is a career member of the United States Foreign Service with more than 20 years of development experience. She joined the Bureau for Resilience and Food Security in October of 2019 as the director for the Center for Nutrition, and she's tasked with providing agency-wide multi-sectoral leadership and coordination for nutrition in close collaboration and partnership with nutrition teams in the Global Health Bureau and Bureau for Humanitarian Assistance. She has served in Mali, Nepal, Pakistan, Uganda, Washington, and Zambia, managing a diverse range of USAID portfolios, primarily in health, but also in education, Feed the Future, energy, food for peace, and the environment. Prior to joining USAID, she worked for various international organizations, the private sector, and served as a Peace Corps volunteer in Guinea. Ms. Steimer has a Master of Public Health degree and in maternal and child health from the University of North Carolina at Chapel Hill. Welcome, and we turn the mic over to you, Shanda.
Great, thank you, Haley, for the introduction, and thank you to the Feed the Future Innovation Lab for inviting me to speak this morning about this important topic. It's exciting to see food safety receive the increased recognition it deserves within the development community because, as we all know, it is a critical area of focus when it comes to improving nutrition outcomes. And so before I turn it over to our exciting panel, and the experts in the room, I just wanted to set the stage for some of the current evidence and knowledge gaps that link food safety and nutrition. As most of you know, back in 2015, the global community came together and committed to ending hunger, food insecurity, and all forms of malnutrition by 2030. And then last year, the FAO released the annual State of Food Security and Nutrition in the World, or SOFI, which concluded that at this moment, we actually aren't on track to meet this goal. And then the report further emphasized the increasing need to provide not just nutritious diets, but safe and nutritious diets to feed the world's growing population. In fact, the SOFI report estimated that 2 billion people in the world did not have regular access to safe, nutritious, and sufficient food in 2019. And that's a statement that very much highlights the fact that food safety and nutrition are completely linked within the food systems that we work with. Nutritious, healthy diets are only possible when food is safe. And so investing in nutrition and food safety, we know saves lives, and it also makes good economic sense for our country. The WHO estimates that every year, 1 in 10 people worldwide will become ill from consuming unsafe foods. And furthermore, unsafe foods cause 420,000 deaths per year. And of those deaths, 125,000 of them are children under the age of 5 years old, one of our most vulnerable populations. And we also know that diarrheal diseases, as Haley also said, are the #1 cause of mortality for children under the age of 5, and then up to 70% of diarrheal diseases are caused by unsafe food and water. So unsafe food not only undermines children's well-being, it threatens their lives. And then when it comes to the economic side of things, the World Bank estimates that these foodborne illnesses cost low and middle income countries $110 billion in lost productivity and medical costs every year. So the consequences of poor food safety practices and their impact on nutrition outcomes, they cannot be ignored. Nutritious foods cannot be considered nutritious if they're not safe to eat. Thus, not addressing the negative effects of unsafe food make it impossible to achieve our nutrition targets, especially when it comes to improving diets. And USAID's Bureau for Resilience and Food Security recognizes this inherent interconnectedness between food safety and nutrition, which is why we now have a division for food safety within the new Center for Nutrition. And we also have 3 programs, including our host, the Innovation Lab, who is hosting us today. We have 3 programs working towards this common goal of trying to ensure that consumers have access to safe foods. And elevating food safety within the agency was needed in order to address the heavy and undervalued health and economic consequences of poor food safety practices in the countries where we work. And with the elevation of food safety came, I think, the recognition that if we want to achieve sustained progress in nutrition, we really need to shift from focusing specifically on households to utilizing a broader systems approach, which includes robust investments in ensuring that food is safe throughout the food systems that we use. And in response to this shift in dialogue towards a food systems approach, we at USAID collaborated with internal and external thought partners, I'm sure many of you on this webinar today, to adopt kind of this a food systems conceptual framework to use as a tool to help provide us with a shared language for how we work within the food systems, as well as a shared understanding of how we can address resilience and food security and nutrition in a more holistic way. And within this framework, I think it's easy to visualize how improved food safety can positively impact the primary outcome of nutritious diets and health, ultimately preventing sickness and death from unsafe food. And achieving meaningful gains in food safety and nutrition outcomes, of course, requires many partners, including other donors, implementing partners, the private sector, local government entities. And of course, we also need the development community to work together as a unified voice as we advocate for improved food safety practices while pursuing our overall nutrition goals and objectives. And at the heart of this effort is the need for evidence. Policymakers and the private sector need strong evidence to motivate and inform investment decisions that address critical nutrition outcomes. And consumers and advocacy organizations need strong evidence to champion local food systems to deliver the safe and nutritious diets that they need. And it's important to note that this year's UN Food Systems Summit really provides us the opportunity for us as a global community to come together and identify evidence-based game changers to build sustainable and nutritious food systems that incorporate the key food safety considerations that we need. So to conclude, we have made significant strides to elevate the importance of food safety, and there are many opportunities for continued research, evidence generation, and global engagement. But despite the fact that we have evidence linking nutrition and food safety, I think we can all agree that there is still a lot we do not know. And thankfully, many of our panelists here today are working to address this very real research gap. And I look forward to hearing about their previous and ongoing research to strengthen the evidence base linking food safety to nutrition and health outcomes. Thank you again for inviting me to participate in today's webinar. And with that, I will hand it back over to you, Haley. Thank you.
Thank you, Shonda. Yes, I couldn't agree more. Of course, as a scientist, as a researcher, I suppose we're inherently biased that it is evidence that will drive the best outcomes. But certainly being able to prioritize where investments are made, and really one thing we certainly underscore here at the Food Safety Innovation Lab is understanding the baseline of where are we with food safety challenges. What are truly the best estimates of foodborne disease? Because without those baselines, it's really difficult to actually have measurable change. And so you're right, we have a great panel of people that are in the trenches working on these very questions at this moment. So it's now my pleasure to introduce Professor Webb, who is a scholar practitioner who has worked extensively on food security policy and practice, as well as in humanitarian emergencies. Today, he is the Alexander McFarlane Professor at the Friedman School of Nutrition at Tufts University. He also serves as the technical advisor to the Global Panel on Agriculture and Food Systems for Nutrition, or GLOPAN, and advisor to the Food Systems for Future Initiative. Before joining Tufts, Patrick was Chief of Nutrition for the World Food Program, and he was until recently a member of the Science Council of the Consultative Group on International Agriculture Research, or CIGAR. Earlier, he lived 6 years in Africa, in Ethiopia, Niger, and the Gambia, while he worked for the International Food Policy Research Institute. He currently manages a portfolio of large funded research projects, including Feed the Future's Innovation Lab for Nutrition and USAID's Food Aid Quality and Review. Over to you, Patrick.
Thank you, Haley. Thank you, everyone, for inviting me to this actually very important panel session. Shanda was very insistent on the importance of evidence to help guide improved policies and programming. So I'm going to talk a little bit about that evidence base, mainly from work that has been undertaken by the Nutrition Innovation Lab, which is a wide consortium of partners in many countries. Next slide, please. In terms of food safety, I'm actually going to start with talking about water safety, which may seem strange, but it's not. Water safety, everyone understands. Water safety matters for health and it matters for nutrition. This is simply showing within a sample of households in southwestern Uganda that even where, next click, even where one sees improved or treated or covered sources of water, one can still see very high levels of, for example, E. coli contamination. Next click, which means that at least even 60% of the so-called treated or improved sources of water cannot be safe, may not be safe, right? So just simply ensuring a pipe or a covered well in itself doesn't make the water safe, and we all know that matters. Next slide. I'm not going to go into the details of the study here. It's simply to state again from Uganda, different study, that more E. coli in the water is significantly linked with more enteric dysfunction, leaky gut, let's say, in children in those environments, and that higher EED in the child is significantly associated with both stunting and wasting, right? So it's clear, unclean water results in poor health of the child, and poor health of the child is associated in various ways with poor nutrition. So that link is clear. Next slide, please. What we need to focus on here is to clean up the food environment to ensure food safety. One thing that has come to the fore during the COVID pandemic is, of course, food safety considerations in relation to zoonoses. And one thing that I'm currently working on in Bangladesh is, the collection of raw date palm means putting up a pot in a date palm overnight, which just happens to be where bats roost at night. And the virus can spill over from bats to humans if those pots are not covered. For example, that's a food safety concern that directly affects health. Next slide. I'm going to focus, however, on one of the more known and serious issues, which is mycotoxins, aflatoxins, fumonazins, and other kinds of foodborne delivery of metabolites that are known to be major causes of poor health. Next click. We know that aflatoxins and other mycotoxins grow on poorly managed farms, and then especially in storage, where high moisture, high temperature, and poor storage conditions cause health concerns. For example, cancers of many kinds. We know that. Next click. But we also know that health concerns matter through the gut. The top image are healthy villi in the intestine. And the lower image is the same villi that are blunted as a result of contamination with mycotoxins, which means that the gut cannot absorb good nutrients, even if they are in the diet. As Shanda said, lack of food safety impairs nutrition in that way. Next slide. So I'm going to just walk us through what does that mean empirically. Another study in Uganda, we found that there's an interaction between inflammation that is caused by HIV. There are inflammatory effects caused by a variety of viruses and other illnesses. And we found that HIV positive women who also had high levels of aflatoxin in the blood had lower weight gain than HIV women who had lower rates of aflatoxin in the blood, right? There seems to be negative synergistic effects going on there between the inflammatory effects of disease and the potentially additive, cumulative inflammatory effects of mycotoxin contamination as measured not on the food, but actually in the blood. Next slide, please. What that translates to, so that was weight gain. That means that women themselves, mothers themselves, are not doing well, and that, of course, triggers the 1,000-day effects through poor birth outcomes. This slide shows results from 3 different studies: 2 in Uganda, 1 in Nepal, from the Innovation Lab. And what it shows is that high maternal levels of aflatoxin in the blood are significantly related, we have discovered, with a range of different birth outcomes, impaired birth outcomes, going from low birth weight in the first column in Uganda, and low weight for age Z-score, and also small gestational SGA, small gestational age, weight at age. That was also discovered in Nepal, by the way, so small gestational age at birth. Also stunting at birth in the first Uganda, high levels of stunting at birth in the first Uganda study, and then impaired head circumference and head circumference for age in the second Uganda study. So it's not a single outcome that we see related to high aflatoxin in the mother's blood during pregnancy. It's a range of impaired birth outcomes that relates to context, right? However, all forms of impaired birth outcomes are contributors to subsequent problems in child growth. Next slide, please. So just focusing on Nepal, not at birth, but subsequent to birth. And what we see here is a high negative association between aflatoxin in the blood of the infant and the odds of stunting subsequently and the odds of impaired length for age. So I'm not going to dwell on this. It's just to point out, so what we saw was high aflatoxin in the mother's blood may impaired her health and pregnancy weight gain. High aflatoxin in mother's blood was associated with poor birth outcomes of many different kinds, and then high aflatoxin in the blood of the child subsequent related to impaired linear growth subsequent to birth. Where is this aflatoxin coming from? Food. It's coming from an unsafe, unclean food environment. Next slide, and my last two. The summary of these particular findings from the Innovation Lab: gestational weight gain, problems at birth, stunting at birth, head circumference at birth, all impaired. There is, remember from the Lancet series of 2013, which showed that being born small for gestational age contributed to perhaps as much as 30% of stunting in children by the age of 3, right? So just one of those impaired birth outcomes can lead directly to subsequent child nutrition impairment. But we're now finding it's not just small for gestational age. There's a range of birth outcomes that are associated. In Nepal, even in Nepal, where aflatoxin contamination was relatively low compared to Uganda, still saw it linked to small for gestational age, and that there are problems that as the child grows, there are still problems in terms of exposure to aflatoxin, which result in stunting regardless of income, education, and location of the caregiver, the mother. So last slide. So therefore, we absolutely need a clean food environment, and we have to communicate this as much as the need for a clean water environment and a clean health environment. These things are linked. COVID has brought zoonoses to the attention. We should try and leverage this renewed attention to the links between food and health, and now health and nutrition through food, leveraged to make those communications more effective. We have new evidence that Shanda was asking for, empirical evidence that directly implicates mycotoxins with poor birth outcomes and child stunting. We need to leverage this for making inroads into getting health ministries, health policies, paying more attention to the food safety dimensions alongside the agriculture ministry and policies who focus on aflatoxin primarily from the food dimension, the agricultural side. So food safety, major contribution to nutrition. We have to ensure that this is a key element of all our portfolio of actions going forward. And I'll stop there. Thank you.
Thank you, Dr. Webb. I don't think it could have been more elegantly put how food safety and nutrition in a very evidence-based way, how they intersect. And certainly as we think about food safety challenges, we think about them from a biological hazard, a chemical hazard, which is where mycotoxins and aflatoxins fall, and physical hazards. And you're also correct in that water plays a vital role across each one of those hazards. So it's a very complex challenge. And the vast majority of investments to date, and as evidenced by some of the work presented today, have looked at aflatoxins as our food safety chemical hazards. And the research portfolio of the Food Safety Innovation Lab has invested some in aflatoxins in our early work and our quick starts, and have invested heavily in biological challenges for the vast majority of our portfolio because it remains an understudied area. However, they are both very important and influence nutritional outcomes, certainly for children. So it is my pleasure to introduce our next speaker. Prabhu Pingali is a professor in the Charles H. Dyson School of Applied Economics and Management at Cornell University, with joint appointments in the Division of Nutritional Sciences and Department of Global Development, and the founding director of the Tata Cornell Institute for Agriculture and Nutrition. Prior to joining Cornell, he was the Deputy Director, Agriculture Development Division of the Bill and Melinda Gates Foundation from 2008 to 2013. He was Director of the UN Food and Agriculture Organization's Agriculture and Development Economics Division from 2002 to 2007. In addition, he worked with CIGAR for 15 years from 1987 to 2002, first with IRI in the Philippines and then with CIMA in Mexico. Pingali is a member of the U.S. National Academy of Sciences and an AAEA Fellow. He has over 3 decades of experience working with some of the leading international agriculture development organizations as a research economist, development practitioner, and senior manager. Pingali has written 13 books and over 100 peer-reviewed journal articles and book chapters on food policy. Over to you, Prabhu.
Thank you, Haley. Good morning, good afternoon, good evening to everyone. It's such a great pleasure to be here on this very important panel. Let me take half a minute to introduce the Tata Cornell Institute at Cornell University. We are a PhD research-based institute that's focused on building evidence around food systems and the direct relationship between food systems and nutrition outcomes. We take a multisectoral view to nutrition and a multisectoral view to food systems, and in that context, food safety issues come very squarely into the overall emphasis that we have in our institute. Next, please. What I'd like to do today is to really drill down and talk about food safety issues in India. Why do we talk about India? India is in a very unique situation. India has a large and growing population of middle-class individuals, middle-class populations and increasingly urbanized, demanding high diversity in diets, demanding high levels of perishable products in their diets. And that then leads to significant food safety concerns. At the same time, India has the world's largest number of food insecure populations, the largest number of children that are stunted. And for these populations, because of their food insecurity and because of the environmental conditions under which they live, food safety is a daily challenge. And consuming unsafe food is a common practice across these populations. So when we think about food safety for India, we need to address it at both ends of the spectrum, at the poor, food insecure end, and the middle income, middle class end of that spectrum. And that's going to be a major challenge for this country. And the scale of the problem is enormous. When you look at India, you see that on an annual basis, over 100 million cases of foodborne illnesses are reported. And I suspect that's a very conservative estimate. And we anticipate that that incidence will continue to rise. And by 2030, estimates are 1 out of every 9 people in India will fall sick with a foodborne disease. So these are big challenges that we have as we look at India as a country. Next, please. So what we've been trying to do is look at food safety from a value chain perspective. Look at food safety across the value chain, going all the way from the production on a small farm to the consumer's plate in an urban environment. And as you go along this process, there are severe food security challenges. At the farm level, we've got traditional problems around exposure to heavy metals, exposure to pesticides, pathogens, etc. But then as you move along, you begin to see that as small farms connect into the urban food value chain, there are significant challenges around the way food is handled, around the water that's used for washing and cleaning food products, the E. coli contamination that Patrick talked about, the storage practices that are used result in significant aflatoxin contamination and pest infestations, especially weevil pest infestations in storage systems. And then as you come into the market, poor market infrastructure, unsanitary market conditions, poor regulation of markets then leads to poor quality, poor, highly unsafe food being delivered to consumers. This is a problem across all food groups, but this is a particularly important problem when you think about perishable products, vegetables, fruits, dairy products, meat, etc. Next, please. So what are some of the major threats from a food safety point of view in India? E. coli is a major problem. Salmonella is a major problem. One of our PhD students, Shuli Vanaja, has spent over a year in a very remote part of Eastern India, tracking drinking water systems and tracking contamination of drinking water systems and the E. coli content in the drinking water systems, and related that E. coli levels to incidents of diarrhea, incidents of several other diseases that come from frequent consumption of contaminated water. And she's been able to measure the health costs associated with exposure to E. coli contaminated water. And what does it take in order to turn this situation around? What kind of investments need to be put in place in order to get to a more safer drinking water system? And it's not just drinking water. If you have E. coli contaminated water, it also affects the processing of food, the washing of vegetables, etc. And then that carries the contamination into the consumer's plates. Pesticide residues are a major problem, a historical problem. Many of the dirty dozen chemicals that were banned a couple of decades ago, you still see many of them around, but you also see new chemicals, especially the use of fungicides, especially for vegetables and fruit. And the residues from there have significant effects on food safety. Heavy metal contamination, lead, zinc, arsenic, etc. As you pump groundwater, you find that the groundwater systems tend to become more and more contaminated with arsenic. And that arsenic then comes into the drinking water system, and the arsenic also tends to contaminate fields and the agriculture produce that comes from that. Mycotoxins, Patrick spent quite a bit of time on that. And I'd like to mention mycotoxins in the context of India. One of our PhD student, Anthony Wendt, who I notice is on this webinar today, spent a year and a half living in Uttar Pradesh, tracking mycotoxin contamination across a wide variety of food groups in rural communities in India, and tested different mechanisms for addressing it. Community-based management system of mycotoxins, and also looking at different storage systems and how to reduce mycotoxin loads to much better storage systems. Next, please. The linkages between food safety and nutrition are very, very clear. Diarrheal diseases is a major problem that comes both from food and from water. And as Patrick mentioned, the connection between child health, child stunting, and diarrheal diseases, contaminated water, is something that is an extremely serious problem and one that needs to be addressed very strongly as soon as we can, but progress in this area has been very, very limited. And diarrheal diseases is one of the primary causes of the high mortality rate for children across India, especially in the lagging regions of Eastern India. Environmental entropy, especially with exposure to contaminants in the environment, heavy metals, etc., is an increasing problem and has significant long-term health impairments. And it has long-term effects both for adults and for children. Now, we spend a lot of time talking about more nutritious food systems. We spend a lot of time talking about improving access to fruits, vegetables, livestock products, etc. But if we don't get the environmental safety side of the story right, then all we are doing is providing increased amounts of unsafe food. So unless we solve the problem of water contamination, soil contamination, and other heavy metal contaminations, pesticide contamination, etc., then just focusing on expanding the diversity of the food system will not get us to appropriate nutrition outcomes. One case in point is aquaculture systems in India, where you do see aquaculture, fish production increasing quite rapidly as the demand for fish is increasing. But you're also beginning to see fairly high levels of heavy metal contamination in the fish. And unless you address that, then you're not solving the problem of poor nutrition, poor access to protein, etc. So this multisectoral approach is absolutely crucial as we look at these food systems. Next, please. So what are the sources of foodborne diseases in India? You'll see that their foodborne diseases cut across almost all the major food groups. But what's really interesting is that you see a significant amount of foodborne illness, foodborne diseases coming out of grain, such as rice and wheat, and pulses, which are really important in the Indian diet because they're the primary source of protein. And what's that contamination? Much of that contamination is mycotoxin contamination, aflatoxin contamination, and also pesticide residues in the grain. So even though grain are seen as relatively safe from a food safety point of view, you see that they occupy a major share of the overall food safety burden within the country. But the bigger growing burden, as we are trying to feed the middle class population, is the increased food safety concerns around perishable products, vegetables, fruit, milk, dairy, etc. And not being able to address safety concerns in the food chain for perishable products is a major issue that needs to be addressed. In terms of deaths still are predominantly related to chemicals in food, chemical contamination. Pesticide residues in food is a major cause for foodborne illnesses, foodborne deaths in the country. But as we look forward, I would anticipate that you'll see a larger proportion of the deaths coming from contaminations in the perishable products that I mentioned earlier. Next, please. I wanted to talk a little bit about Anthony Vance's work on mycotoxins. As I mentioned earlier, Anthony spent a year and a half living in Uttar Pradesh, tracking mycotoxin levels in Uttar Pradesh. But then he also looked at several other states in India. He was in Bihar, he was in Orissa, and he was in Telangana. And he sampled mycotoxin levels across various food groups that you can see here in this chart. And what he finds in this work is that there's significant levels of mycotoxin contaminations in several food groups, in groundnuts, in pulses, in rice, sorghum, millets, etc. Now, in many cases, in rice, for example, you may find that the mycotoxin level, the aflatoxin level may be below the maximum permissible level. But because you're eating such a large quantity of rice, then even though the mycotoxin level is low, it may have long-term effects on health. And so one needs to be looking much more carefully at aflatoxin contamination in grain, in pulses, etc., and look at ways in which you bring that bar down because of the huge quantity that's consumed. And that's the challenge, I think, that we need to be addressing with the food safety regulatory community within the country. But what his work shows is that through community management, one can make significant progress in reducing the incidence of mycotoxin through community managed storage systems, to community managed monitoring and tracking systems, etc. One can have a major effect on mycotoxins. There's several papers that have come out of this work, and I'd welcome you to look at them. Next, please. So it's not as if India doesn't have a food safety authority, and it's not as if India doesn't have food safety standards and regulations that are in place to monitor contaminated food, etc. But the reality is that you can have all of these systems on paper, but in terms of actual implementation of monitoring system, in terms of actual implementation of the regulations, we fall short. And so you find that many of the markets, the regulated markets where agriculture produce is sold, they call mandis in India, don't have adequate monitoring systems to trace quality, safety, and to preserve quality as you go through the value chain. So that's been a big problem as we look at the existing infrastructure that's in place. Now, the private sector has done quite a bit of work on creating more safe value chains for the products that they procure from small farms. But the overall state-managed systems don't yet have that level of food safety that one would want. And for smallholder farmers, it's a particular challenge because for many of them, they're consuming a large part of what they produce. And while consuming a large part of what they produce, they're also consuming a large part of the contaminated food on their farm. And because of that, you see foodborne illnesses in rural areas that are very widespread across rural areas. And there's very little monitoring of that. There's very little monitoring of the incidence of foodborne diseases, contamination of food, contamination of water systems, etc., across rural India. And that's part of the reason why the numbers are so high on the incidence of foodborne illnesses and foodborne deaths. Next, please. I think there's a lot one can do in addressing food safety. And one would want to look at this from a food value chain perspective. I think you need good agriculture practices right up front at the farm level, better agronomy, more safer use of chemicals or not using chemicals at all, etc. on the farm. And then much better post-harvest processing, drying, storage, etc., which are absolutely crucial for controlling mycotoxin contamination and pest contamination. That level of storage systems are necessary and drying systems are necessary, and we don't have that. Cold chains are really important as you think about this growing value chain from small farms to urban middle-class consumers and the perishable products that are demanded by the middle-class consumers. Cold chain facilities, cold chains at the market level and control the temperature controlled transport systems, etc., are really important. One of my PhD students, Jocelyn Bateau, spent a year in southern India looking at fresh vegetables, tomatoes, and the spoilage and the waste in tomatoes across the value chain. And what she found was that as tomatoes go from the farm through the value chain, you lose in terms of quantity, you lose quality, but importantly, you also lose nutritional content. And that's a major problem. So by the time these fresh vegetables get to urban consumers, there are losses on quantity, quality, and nutrition. And one of the ways you can address that is much better temperature control transport systems, much better infrastructure for markets, etc., that need to be put in place. And then regulatory systems need to come in a much bigger way than they are today. And I think part of the reason why the regulatory systems are not as strong is because the demand side of food safety is not as strong either. Consumers, even urban middle-class consumers, don't necessarily say, we want safer food and we're willing to pay for safer food. And unless that demand side awareness changes, we're not going to see the changes that are happening, that need to happen on the supply side. Next, please. And this is my last slide. I think as we think about food safety, we need to think about it in a One Health paradigm. We need to think about it as the interlinkages between human health, animal health, and environmental health. And we need good agriculture practices to protect the farm environment. We need good animal production practices to prevent zoonotic disease breakouts happening. We need good environmental practices to prevent the pollutions that come into place. And we need behavior change. We need a way in which producers and consumers understand the importance of food safety and understand the importance of promoting food safety. And I think if we can get there, if consumers drive the change, then we'll see a big change happening across the board. Let me stop there. Thank you very much.
Thank you, Prabhu, for some amazing comments. And you highlighted one area that I am increasingly interested in, and it's turns out a relatively new area of study, but the economics of food safety, and look forward to maybe some further discussions on that. Certainly. Just a reminder, if you have questions for the panelists, and it looks like our list that we're curating is becoming very large, we encourage you to add those to the Q&A section, which is in the middle of your screen at the bottom. It's my pleasure to introduce Dr. Jessie Vipum, who's an assistant professor at Kansas State University in food microbiology and food safety. Her research focuses on improving the global understanding of foodborne disease and its impacts on public health, particularly for vulnerable populations, and providing adoptable and applicable solutions to reducing foodborne pathogen contamination in various food value chains, such as physical interventions, training, and education. Jessie has been involved in food safety and food security in Central America, South America, Africa, and Southeast Asia. Her research aims to provide scientific resources and data to improve the safety of food produced in various production systems, support the production and consumption of nutritious foods, and to increase involvement and empowerment of women in agriculture production and processing, and to prevent food loss and waste due to unsafe food. Jessie, over to you.
Thanks so much, Haley. I appreciate it. Good morning, everyone. Thank you so much for the opportunity to be here. I think I'm going to shake things up a little bit. I have to hold true to, I'm a middle child, and so I have to be rebellious in nature. And so we're going to shake things up, and I'm actually going to spend my talk really focusing on biological hazards, particularly bacterial hazards. And I really want to zoom in on the role of fresh food markets in terms of food safety and nutrition, and the role that they can play in providing both nutritious and safe food. Next slide. So we all have probably at some level seen these statistics. I put them up at every talk I give, right? 1 in 5 people are food insecure. 1 in 8 people suffer from foodborne illness. And so I think we can get pretty casual about some of these estimates. However, I think something we fail to step back and think about, next slide, is that commonly when we look around the world, that one person typically is the same person. And so when we think about vulnerable populations around the globe, a lot of populations who are food insecure and who are living sort of on that edge of poverty are also living in situations where the food that is available to them is commonly unsafe. And we've heard a lot about how these populations are experiencing issues with unsafe water. They're experiencing issues with being exposed to mycotoxins within grains. However, I don't know that we spend a whole lot of time talking about the biological or bacterial pathogens that are in their environment. And that can be just within their daily environment around their household or directly on the food that they are consuming. Next slide. I have a real passion for fresh food markets. And so anyone who knows me knows that I haunt the corridors of fresh food markets all over the world. And for those of you that maybe don't know what a fresh food market is, this is something that is, you know, in the US, very comparable to a farmer's market. And if you are not from the US, you may actually have a little bit more of an idea of what a fresh food market is, because they're very common throughout most of the world. And a lot of the world sources their food through fresh food markets. When we think about fresh food markets, I think they really play such a beautiful role in terms of providing physical access to nutritious diets, particularly on a local level. And so a lot of the work that we see happening within development around the world, particularly from a nutrition perspective, is how do we improve local access to nutritious diets, right? Diversifying diets to really provide populations with nutrient-rich diets. The challenge becomes is that nutrient diets, nutritious rich diets are nutritious for all. And so our little microorganisms, they like that nutrition too. And so as we diversify our diets, as we get those nutrients into our diet, our pathogens or our microorganisms, they get happy too. And so they like to be in that environment, and that poses a real challenge. And so if you look at this picture that I have on the slide over to the left-hand side, this is a real picture that I took in a fresh food market in Cambodia. And if I were to look at this from a nutritional perspective, this picture is maybe a little bit exciting, right? This is a local rural market. I see some lean proteins in this picture. There's some leafy greens. There's some fresh fruits in this picture. And so from a nutrition perspective, this is maybe a pretty exciting photograph from a market level, right? I've got a pretty diverse diet being presented to the local community. Now, if I put on my food safety hat, my opinion changes a little bit, right? There are some pretty problematic scenarios going down here. And so what we typically see with fresh food markets around the world is that they commonly have huge deficiencies in terms of food safety. And a lot of these deficiencies are not necessarily astronomical changes that need to occur, right? They're small changes that can happen that can really improve the safety. And they come down to having the proper infrastructure, having proper handling practices, and following proper sanitation within these markets. So next slide, please. So I thought that what I would do today is I would actually share some slides with you on some preliminary data that we have from Cambodia, fresh food markets in Cambodia, where we looked at non-typhoidal Salmonella enterica within fresh food market settings to just sort of set the stage for what is really happening from a biological perspective in these markets, and then what are some of the ways forward in terms of still providing that nutritious food, but doing it in a much safer way. For those of you who may not be versed in bacterial pathogens, non-typhoidal Salmonella enterica is a very relevant group of pathogens to a foodborne perspective. We find them in all food products, and we typically consider them to be all serotypes to be potentially pathogenic to human beings. So incredibly important group of pathogens that we want to have an understanding for, particularly at a market level, right? Which is that last step before consumers have access to it. Next slide. So we've been doing some preliminary research in Cambodia for about 4 years now in fresh food markets. We've collected samples from these markets from a vegetable perspective, so vegetables being sold within those markets, as well as environmental samples from those markets. This slide is to present you with data from the vegetable samples. What I really want you to take away from this slide is that what we found in these markets is that we had an overall prevalence of 28.2%. And so that's a pretty high prevalence for, like I said, that last point in the value chain, right? So we're at the market level. Consumers are going to purchase these vegetables and take them home after this point. We also saw that across vegetables, so we sampled lettuce, tomatoes, and cucumbers. These are vegetables that are commonly consumed raw within Cambodia. We saw Salmonella present in all vegetable types. We did this study in 2 different seasons. That's the rainy season and the dry season. We did have a significant interaction. So you have to look at this with that in mind, that there was an interaction. The highest prevalence we observed in these vegetables was in lettuce samples in the dry season. And so really the takeaway message from this is that we have Salmonella enterica present in all vegetable types at the market level, and that we see a seasonal difference in what is occurring from a prevalence perspective. Next slide. When we looked at the environmental surface data, we saw some similar outcomes. And so we again looked at market surfaces, that's non-food contact and food contact surfaces. We define non-food contact surfaces as anything that did not have direct contact with a food item, and food contact surfaces as any surface that had direct contact with a food item. So that could be a scale, it could be a basket. Our non-food contact could be a wall, could be a floor. And we looked at that in 2 different seasons, the rainy and the dry season. This data mimicked the vegetable data. We saw the highest prevalence in the dry season, and I'm so sorry. I think we ended up with the wrong set of slides. This actually has a typo. This graph is incorrect. My apologies. This is backwards. This should be we have an incorrect rainy dry here. So the dry season actually was the highest prevalence, and it was on food contact surfaces. And so what this data really helped us to understand is that we probably were seeing cross-contamination occurring from vegetables coming into that market onto food contact surfaces. The other thing that I think that this data really helps us to understand is that we are seeing cross-contamination within markets, and that is backed up by observational data on market level interactions. And so just by observing what happens within markets, we can tell that we do have a pretty high level of cross-contamination happening within these markets. Next slide, please. So when we then took the isolates that we collected from these markets and we conducted whole genome sequencing, as a part of this, what we were looking to do was to have an understanding of the serotype diversity that we saw within these market environments. And what I really want you to take away from this slide is that there was a pretty high level of serotype diversity. And what this communicates to us is that we probably have a pretty significant amount of contamination points that are occurring within these markets. And not surprisingly, we see the highest level of serotype diversity on things such as baskets, floors, scales. So areas where we see a lot of movement. Next slide, please. So this slide is, yeah, thanks. Thank you, I appreciate that. That was a slide that we had decided to take out. So where is this all taking us? This is all kind of driving towards, right, that we have this market level contamination, right? We're seeing contamination of salmonella on vegetables. We're also seeing contamination on market environments. But what does that mean ultimately? And that's the challenge that food safety scientists face every single day. I can measure the prevalence of mycotoxins or the prevalence of salmonella on a food product all day long. But until I connect the dot that actually caused a human illness, I really am in that space of, what does this mean? And so what we really wanted to be able to do with this study was to look at whether or not the market level isolates that we had collected, did they have any connection to clinical cases? And this is something that's really challenging to do within the country of Cambodia, as well as many other low resource economies. And so we were very lucky to have the opportunity to do some whole genome sequencing. And what we did find was that, in fact, we had multiple environmental samples that did have very close relatedness when we did a SNP analysis to clinical cases within the United Kingdom and the United States. And I don't want you to get muddled down in what is a SNP analysis. What I want this slide to communicate to you is that we were really excited to be able to connect a dot, although a little bit of a faded line, to a set of clinical cases, really sort of communicating that, in fact, these market level isolates had some connection with clinical isolates, meaning that they had the potential to cause disease. And so that was a really important thing for us to be able to do. Next slide, please. So with that, I want, the whole goal of me sharing that data with you was to be able to really, I think, showcase that when we think about fresh food markets across the world, we have a real opportunity to do a direct intervention from a nutrition perspective, right? How do we provide nutritious diets to local communities? But unless we are focusing on how we are controlling the environments in which we are providing those diets, we may actually be doing more harm than good. And so, I think I would be remiss as a food safety scientist to not take the opportunity that has been given to me with this webinar to kind of, do a call for arms, right? Is it time for a clean revolution? Which is to say that I'm so appreciative of the discussion today, where we're connecting the dots between food safety and many of the other disciplines that are out there. But I do want to take the time to really say that food safety does have a role to play on its own, and it really does require its own targeted funding and its own targeted effort. And so as a part of that, I really do hope that as we move forward from a research perspective, from a policy perspective, that food safety will be given a little bit more time and space to have its voice heard. And as a part of that, I really do want to finish with a couple of messages in terms of what food safety really needs from a targeted perspective for it to really, I think, have the opportunity for growth that will be required for success. And a huge part of that is really investment in terms of ensuring that we are putting in the right types of infrastructure for sanitary design to ensure that we are able to produce food in a safe way. I want to encourage the promotion of public health on a holistic level, right? So nutrition is a huge part of what we're doing, but really encouraging public health outcomes and the recognition that disease is an important part of public health. And without that recognition of disease, we're really going to fall short. I can't stress enough the need for national experts, particularly data scientists. So food safety really does require us to begin to understand cause and effect, and being able to statistically prove certain things is really important. And so having the breadth of data scientists that we need on a national level, I think, is incredibly important. And then investments in national surveillance and monitoring programs. So back to my final slide, unless we're doing surveillance and monitoring, it's really hard for us to be able to connect those dots. And to some points that were made today, there's a lot of data on chemical hazards throughout the world. And we've done a lot of monitoring on that. And so sometimes when data gets presented, I think typically biological hazards or bacterial hazards fall short. And I think that comes from a lack of data, not due to the fact that they are not playing a huge role in disease throughout the world. And so with that, I just call to arms on maybe it's time for a clean revolution. And thank you so much for the time. I know I went a little bit quickly, but I wanted to make sure that we stayed on time. Thanks so much.
Thanks so much, Jessie. I don't think you're going to get any fight from this team on a clean revolution. I love it. It's really great, great branding and a really, a very clear message, but certainly, as you highlighted, a very complex problem. We're really excited that you're bringing the discussion full circle on prevalence data in foods and connecting it to true human health outcomes. Whole genome sequencing is really becoming quite the tool for helping us demonstrate the scope of the challenges and help us hopefully intervene in some of those challenges. Well, it is time for our entire panel discussion, and we have curated questions from the audience, both from the chat and from the Q&A sessions. And panelists, they're great questions. If you've ever been through a master's or PhD defense, they may have that very same level of intensity. So I would like to start off with, I think our whole panel should be able to turn on their videos to join us here. They said we've had amazing participation from the audience, and I think if I may, start off with a question for Shanda Steimer. Really, as she's highlighted, she has an amazing 20-year career advancing health and nutrition. And my question to you is, among those 20 years, what are some of the hallmark moments where you observed that food safety nutrition challenge and it started to really, I guess, come to the forefront as a part of this nutrition discussion?
Thanks, Haley. It's kind of interesting. I don't know if I would have like specific hallmark moments, because I feel like, we're always progressing and learning more and things are changing. I mean, having worked in health and maternal and child health, diarrheal diseases have always been front and center, and I think it's been interesting for me in the last few years, as more as the research, again, collecting data and always learning from what we're doing, and the evidence about diarrheal diseases and what it takes when it comes to water. And so some of the in my opening remarks, I talked a lot about food systems, but water systems are another one where a lot of our focus has been on households and washing hands, which that doesn't go away. That's important, but you have to have the system there to support it, and you have to have a water system to support households engaging in hygienic practices, and also businesses and things like that. So to me, that's been an interesting shift, and it sort of reflects again, where we've spent a lot of time on households, but we really have to broaden how we look at things and look at the systems that affect those households. And then the second one, actually Patrick already talked about it, but I was in Nepal when Patrick asked, and we talked about the study on aflatoxins. And it's another one of those where it's bringing different sectors together. In this particular case, I think we've known from, in terms of cancer and where, how bad aflatoxins are when it came to that. And it had been a focus of the Ministry of Agriculture, but, in a different way, oftentimes related to, whether or not they can export, their products and things like that. And so, we hadn't really looked at aflatoxins when it came to, birth outcomes and a different way of looking at it. And so when Patrick introduced, sort of proposed this study that I think had already been started in Uganda to do in Nepal, it was really interesting to really sort of sit with, agriculture colleagues and health colleagues and really sort of talk about, how that comes together and why it's important for both health and agriculture and all of that. And when you look at advocacy, for me, the Ministry of Agriculture is already sort of advocating for improved, food safety when it comes to aflatoxins for these reasons. But if you can get the Ministry of Health behind it for, this broader set of reasons, that just makes for a more powerful argument. And so having more evidence related to that, I think, and it was just, for me, interesting to really bring those sectors together. So I'll leave it at that.
No, thank you, Shanda. That makes perfect sense. And I think in that vein, there was a question from the audience for really, I think you, Patrick, and it was concerning the study that you did. And the question was concerning aflatoxins and mycotoxins in pregnant women. Did the study possibly also look at normal weight women that might have also had low gestational weight babies to compare women with normal pregnancy weights?
Mm-hmm. So, yeah, obviously a good question. I didn't have time to go into the study design, but yes, we did. It wasn't selecting women who had low weight gain or whatever, right? We weren't looking at low maternal weight women. It was just a sample of women who were pregnant, so that it covered a whole range of weights, and it turned out that weight gain was associated, regardless of the mother's original weight, with both HIV and aflatoxin in that case. And just to echo something Shanda just said, it was so important, this link between mission staff or donors being willing to, in a sense, take a risk in funding, fundamental research, which isn't always done, involving human populations, but with a view to influencing different ministries in government, right? So that different sectors could actually understand each other better and work together better. And I think, the evidence base has to be there. To convince a Minister of Health and a Minister of Agriculture and a Minister of Trade that this is an important topic. So really, hats off to USAID for supporting this kind of work through these innovation labs.
Thanks for your response, Patrick. I'm sure the audience never really appreciates that context. I'd like to switch gears a little bit to Prabhu, and this is a question that certainly I'm particularly interested in. But what are the potential impacts on food safety and nutrition if India continues to pursue their free market approach? It's quite the revolution in India right now.
I'm going to get into trouble on this one, but I think the benefits would be enormous if you move to a much more market-oriented value chains. The private sector in India has had much higher standards for food quality and safety, and bringing in small farm households into the urban food value chains, building in that links with private sector value chains, would then bring in investments in cold storage, in temperature controlled transport, in monitoring systems, in quality control systems, etc., which are not in place today. And while there's a lot of discussion about what's happening in India today, I think there hasn't been enough discussion on what are the benefits of liberalizing the market. And as I said, I'm sure I'm going to get a lot of hate mail on this one, but it's important to put my perspective on the table.
Well, I appreciate you taking the risk. I know it's a very sensitive and it's a very complex issue, but I certainly appreciate your response. Jesse, I have a question for you. That's also, I think, it's an interesting challenge as we think about biological challenges. You showed us really great examples of how we can use whole genome sequencing to make the connections between kind of almost cause and effect, like which food is contaminated and what are the human maybe outcomes. There's also the other discussion of antimicrobial resistance. So can you talk a little bit to what you're seeing and how that ties to nutrition?
Yeah, absolutely. And so there's no doubt that when we look across the world, AMR is a huge topic. And I'm going to use the platform just real quickly for a personal talk, and then I'm going to answer your question, which is that I think that investigating AMR is an incredibly important pursuit. I do think that there are certain contexts in which just understanding what is there is an important first step, and then beginning to build is kind of an important next step. And so I think that AMR is a part of the discussion, but there are certain contexts where even just understanding what is the most important pathogen still needs to be answered. In terms of AMR and the role that it plays from a nutrition perspective, I think one of the biggest things that we need to think about in terms of resistance is that, clearly back to some points that Patrick made, is if we have kind of perpetual disease, right, that has issues with our entire intestinal system, right? And so that can be from a mycotoxin perspective. We also see a lot of data that demonstrates if an individual has repeated episodes of diarrheal disease, particularly when they're very young, so under the age of 5, that really has impacts on their ability to take in nutrients, to have a healthy immune system. And so if we see AMR really begin to take place in some of these settings, then we lose some of our frontline defenses, right? So such as antibiotics. And so if I can't treat diarrheal disease with my frontline defenses, all of a sudden I'm just adding complexity onto an already complex scenario. And then that's going to just further push those vulnerable populations into positions where they don't have solutions for the challenges that are in front of them. And then you have these environments where you just have this perpetuating poverty, low nutrition, unsafe, unhygienic environments, and the cycle goes on.
Yeah, thanks, Jesse. Nothing like losing some of your options when it comes to managing what's already a rather significant challenge. Patrick, just kind of a more philosophical question. You've studied nutrition and really at the interface of food safety for a long time and have some really amazing work planned for the future on really some of this interface. What do you think are the next big food safety and nutrition questions that we need to be answering? What are the next big studies or thoughts that we need to be addressing?
Well, some of the things that Jesse has mentioned are right up there. I mean, we do need, so I'll try and keep it concise because this is a big area, big topic. One, I think we need to better understand how different elements of food safety threats, whether it's salmonella or aflatoxin or whatever, how they actually function in the gut environment. So what's going on in our microbiome, we are still assuming a lot of the pathways, and without really knowing them. Of course, the work that looks at DNA can take us closer to the answers, and we need the answers to figure out what's the best solutions, right? A lot of quack remedies are out there. You should eat turmeric, you should eat whatever it is to resolve these issues, and that can sometimes lead to more problems than benefits. So better understanding what's going on. My point about the HIV and aflatoxin potential synergies or amplification effects. We need to understand what's going on inside us to figure out what to do outside us to protect ourselves. Secondly, I would say it's not just aflatoxin. There are multiple mycotoxins and other forms of threats that may be also synergistic, right? We don't always find fumonisin and DON with aflatoxin, but sometimes we do, and it's not really well understood. Does one swamp out the others, or are there added effects of these multiple toxins, and therefore do we need more integrated solutions to resolve, rather than laser focused on a single problem? And then finally, up at the bigger level, absolutely, Prabhu is right about the private sector role in setting standards and achieving more food safety, but that's also got to be allied with greater enforcement of food safety regulations and policies that already are on the book but rarely implemented, which requires enhanced monitoring, surveillance, and testing. And those facilities are often simply lacking in low-income settings, and they need to be made available.
Patrick, following up on that, one member from the audience did ask, how many samples do you need to take from a market or from a greater food system? And that's a question that haunts all of us. It really does.
It is a question that haunts all of us. And at the end of the day, you take the samples that you require to be convincing to your intended audience. Right. So if you really, where you're trying to convince a minister of health of the human health implications, you actually need a very large sample of human subjects to achieve the statistical significance that they would require. If you want to convince a minister of trade that better managing peanuts for export, you may need much lower samples of product as opposed to blood. So it depends on the audience, essentially. But I would say one last quick word. One big question that remains to be answered is how much is too much from the human perspective. Shanda knows this. We do not yet know. Most countries like the European Union set zero tolerance. There should be no exposure essentially to aflatoxins. But most countries are a little bit above that. Does that matter? Does a little bit more than that matter? At what point is there a threshold where a little bit chronically in terms of relative risk is not going to be a major problem? But at what point does that stop and it becomes a major problem? We don't yet know, because the science hasn't determined that threshold.
Yeah, another looming question, certainly. Hygiene hypothesis. When are we going to really have resolution on that? I know I think zero tolerance is, I think as we look forward and food security and the size of the population that we need to feed, we're going to have to adjust. Certainly, I think in the US perspective, we will be adjusting that perspective, or at least I hope we do it from a sustainability standpoint. I'll ask this question to Prabhu, but really to the panel. The question is if, as you look at settings where many food safety issues have been addressed or are being addressed, what do you think is the relative contribution, I think I'll say, to success? of technology versus education? Is it a 50-50 split? Is there a bigger driver? What will help India, I guess, to reach their true food safety goals?
Behavior change, behavior change, behavior change. That's what's going to take. And somebody in the chat said, oh, why did I put only a single woman on the slide and not put a man? But I did it on purpose because our work shows that empowerment of women in rural areas plays an enormously important role in promoting a more nutritious food system and promoting safer child rearing practices, etc. And if we can bring in food safety behavior change into that same empowerment umbrella for women, then that can have a phenomenal impact on food safety. Education is definitely a major area. The technologies are there. The systems need to be put in place, but public awareness and public demand can make the change.
Other comments from the panel? Go ahead, Jesse. Sorry, I saw you're off mute now.
I think, and I always have a hard time eloquently voicing this opinion, and back to some of the points, I might get thrown out of all food safety clubs for what I'm about to say. I think that in order for behavior change to be successful, you have to provide options, right? I think that people push back from changing their behavior when they feel as though the only option is, this is how you make safe food, and if you don't make safe food, you don't like children, right? And having options for people, and kind of back to the point of even this zero tolerance on aflatoxins, right? If the discussion moves much more to how do we think about producing safe food in the context of different environments with the resources that are available to that environment, and then what is the level of safety that provides health and provides economic opportunity and production success, then I think that provides an environment in which people are much more willing to play along. And I think a place where food safety has gone a bit amiss is that we have some food safety experts that have taken this mindset of food safety looks like this. And it's these zero tolerance things. It has to be cut and dry versus here are options. Here are ways we think about the risks that are in front of us, and how do we collectively navigate those hazards and risks to provide the best environment for the context that we're working in.
No, I would agree with you, Jesse. It's a continuum. The categorical or zeros and ones approach is it just isn't sustainable, and I don't think it's actually going to allow us to achieve our true goals. We are at time, and I know we have a lot of questions. We will, if you will switch to the next slide, we will be hosting another webinar. We thank the nearly 200 participants that joined us today, and for the wealth of questions. It gives us a lot to think about and really helps us, remember all of the challenges of food safety and the interface with nutrition that we're trying to tackle. Our next webinar is scheduled on March 16th, again for an hour and a half, so we have time for panel discussions. And our focus will be on food safety and the private sector. There will be a subsequent webinar. There was a question in the chat on behavior, and we will address more of those questions in our 5th webinar, which we will be scheduling in April, but we hope you will be able to join us in March. Thanks again, everyone, and thank you to our panelists. Really great discussion and a wealth of expertise and knowledge here today. Thanks so much.